Welcome, everybody. Welcome to our health dialogue. This dialogue in 2023, MTN Bushfire. We are happy that we are on this dialogue and we welcome to you listeners. MTN Bushfire is strongly invested in supporting and promoting health to the people of Eswatini and our festival visitors. So welcome, we bring our fire here. I'm rejoicing Kambule today with you here, and I have a very good panelist that I have bringing our fire to discuss the right to health in the context of the UN Declaration, 75 years of the UN Declaration on Human Rights. Ladies and gentlemen, I'll allow my panelists to introduce themselves, bringing their fire to the human rights dialogue. I'll start over with you. Introduce yourself to our listeners.
Good morning, everyone. I'm Ernestine Suzzane, a migrant, and I live in the Lubombo region in Malinza Reception Center, and I'm a change agent for the International Organization for Migration, and we deliver information on sexual reproductive health rights for migrants, sex workers, and young vulnerable people. Thank you.
Great. She brought her fire to discuss issues of health with vulnerable groups. Over to my right here. Introduce yourself at the far end.
Hello, everyone. My name is Talon Jovo from the UN Youth Advisory Board. So I come from Monene in Manzini. We teach people on SRH and HIV.
Wonderful. He brought his fire to the show. Yes, on my left. Introduce yourself.
Good morning, everyone. I'm Busisiwe from Ministry of Health under Cancer Control Unit. I'm the Regional Cancer Coordinator for Cancer Control. Thank you.
Thank you. Over to my right. Introduce yourself.
Good day, everyone. My name is Mpigele Lamini. I come from Nature. I'm the head of programs, basically in charge of overall programming in the country when it comes to HIV and AIDS, including HIV prevention.
Thank you very much. Now, as I indicated, we are here to discuss issues of right to health, which is a fundamental human right, and with a focus mainly on vulnerable groups, the young people. And our focus today will be on access to health. This year, we really appreciate the festival that it brings its fire in many ways, even having these health-themed dialogues to see that we have the right to care and we have access to health. So we start with the young person. How is the access to services for the young people in the country?
First of all, I'd like to thank the government for allowing most young people to access the health services in terms of the SRH sector. We have seen the government allowing children as early as 12 to access their family planning, which is a good thing because it's a form of the way that can help curb the spread of teenage pregnancies, which is a good thing for the young people so that they can survive and have less stress of teenage pregnancies.
So in your view, how can we improve the SRH youth-friendly services? Do we have that access? How is that arranged in the different facilities?
Most health services or health centers have a corner, or let me make an example of FLAS. FLAS is a youth corner whereby they have management with that focuses on young people so that it can be friendly, so that it can be more easily, young people can easily access or easily express themselves in terms of how to talk to the health practitioner and stuff.
That's great to know. So yes, young people, youth-friendly services, youth-friendly corners and facilities, take your fire there, access the health services. Now coming to Estina, in your view, how is access to SRH services for migrants?
Okay, most migrants, they prefer self-medication and using self-test to test for HIV for fear of discrimination, lack of documentation, and language barrier at healthcare facilities. But then with the SRHR services, we are trying to bring the services to the people and without them needing to have any sort of documentation and being asked so many questions that make them uncomfortable.
Could you share some experiences as a young person, a migrant, a young person? What's your experiences like?
As a young person and a migrant, most of the time, whenever I go to any healthcare facility, I just have a discomfort. Most especially when I feel like I want to test for HIV, because most people will give you the eye because there are so many restrictive gender norms on youth sexuality.
Mm-hmm.
Yes, so they just don't feel like as a young person you should. They don't feel like as a young person you should go to healthcare facilities for such services.
Then you're highlighting a very important point on the attitudes or perceived attitudes that young people see as they go to facilities. Would that have any impact on your access to health? Can I hear from the youth ambassador?
Can you repeat the question again?
She pointed out that the attitude or your perceived attitude of people looking at you going to a facility would prevent you from getting there. So I wanted to hear your view or your experience in that.
So back then, most youth or young people who had this challenge of not going to clinics because they know they're gonna see an old person who's gonna judge them. Because let me make an example on the SRH sector. Maybe they want to do a family planning. So if they go to the health facility, they're gonna see a mature or old lady is gonna judge them and say you're sleeping, you're having sex. So that's what prevents them from going to the health facilities, which is why the youth now friendly doctor or nurses or people who are trained, they are now trained to be youth friendly and welcoming to the young people.
We can see, thank you very much. We can see now that as providers, as adults, as uncles and aunties, we have a role to play to improve access to health services, SRH services for the young people. Now, coming to HIV prevention, Mr. Dlamini, as a country, do you think we're doing enough on HIV prevention?
Thank you so much. As a country, we usually measure the impact of our HIV prevention intervention using the HIV incidence indicator. So we have seen that it has gone down and drastically gone down in terms of HIV new infections. So it means we are doing quite well with our HIV prevention efforts. But we still need to do quite a lot when it comes to HIV prevention. We are emphasizing these days combination HIV prevention programs, so that at least we don't leave anyone behind when it comes to HIV prevention efforts. So we are doing well as a country, and we have in the last couple of years implemented what we call high impact HIV prevention services. Like, for instance, your pre-exposure prophylaxis. So these days, we even within just that particular one, we have different options. You can be enrolled in PrEP if you know that you are always at risk of HIV infection. And risk can come from different angles. You might be in a serodiscordant relationship where your partner is HIV positive and you are negative. Or your partner, you don't trust your partner. You are allowed to be in the program. And now we even have event-driven PrEP, where when you know that you'll be bringing your fire to the fire and you are not too sure of what's going to happen over the weekend, just visit your nearest health facility so that whatever happens during the weekend, you are safe. You have taken your PrEP. If for some reason you look at the corners within the Bring Your Fire venue and you don't find a condom, you'll be well taken care of if you take PrEP before you are exposed. I'm not saying people should bring their fire and expose themselves, but I'm saying, as we always say in HIV prevention, when you come to bushfire and you go anywhere and you feel and you think you're going to be exposed, we have provided all the options. There are condoms, and one can take the opportunity to applaud the Bring Your Fire team. There are also condoms everywhere, and as a country, in terms of condom programming, the condoms are everywhere. And also, if you look at VMMC, in terms of coverage, we're almost 50% in the adult population. And if you're also looking at, our presence of HIV prevention commodities and products in health facilities, we're doing quite well. We are happy with that. And we always speak based on evidence. So the evidence saying, in terms of HIV new infections has gone down. But there are certain things that we need to do, targeted interventions for subpopulations, like your sex workers, your men having sex with men, LGBTQI, we still need to focus on that. We still need to implement HIV prevention at scale. If you look at life skills education, for instance, we're still in selected schools. If we can expand so that we can reach more in-school youth with some of those interventions.
Great. You talked of combination prevention, and I have particular interest on you speaking to the adolescent and the young person. They're bringing their fire, we know. So what's the kit that you can give, the preventive kit that they come with as they bring their fire?
As they bring their fire, in terms of HIV programming, and also in terms of, profiling your risk, you need to ensure that one, that bringing your fire is also about taking care of yourselves when you come here. We have issues with social asset building within the youth, where you probably might be someone who's lacking a bit in terms of resilience. We will have quite a lot of men bringing their own fire here. Some of them have got money. Some of them have got cars. And we have seen from evidence, from data, that the fewer rich people are actually driving infections to the vulnerable population. So if I'm an adolescent girl and a young woman, and I don't have money to pay for my tuition fee, the temptation is I will find a blesser, I will find a rich man who can finance my tuition fee. Same thing with here. There are men who are willing to buy your ticket, the entire ticket for the Bring Your Fire Festival. And we are saying, in as much as there's that offer, you also need to do a lot in terms of just risk perception. And when you come here as a young man and as a young woman, make sure that you have taken all the available HIV prevention options so that you don't bring your fire and go back with HIV. So you can go for PrEP, you can bring your condoms, you can make sure that everything that's available within the HIV and AIDS space is well taken care of. And we're also in the process, in fact, it started quite a few years ago, where we are doing a lot on economic empowerment. Because combination prevention is saying, so long as you are providing condoms, you're providing PrEP, but as long as I'm vulnerable, I don't have anything to put on the table in terms of food, I am going to rely on the blesser. Mm-hmm. So we have those initiatives, private sector companies have chipped in, Standard Bank, for instance, in terms of vocational skills training. There's the youth fund. We are assisting the youth to know how to apply, because we have received feedback that the youth fund, revolving fund, few youth, young people like you had mentioned, are actually applying and being successful. So we're assisting those who are willing to start businesses, so that at least their vulnerability to ENAP blesser is reduced.
Mm-hmm. Thank you. You've highlighted a number of things that young people can do and what kit they can come with as we are bringing our fire this year. And we greatly appreciate the Bushfire team that always makes the services accessible. So to our people there, please utilize the services that are available within the festival and partnering with the health and partnering with the people of Eswatini. Now coming to HPV, the HPV vaccination. We are aware that the country will be integrating that in the package of health services that the ministry is bringing to the people. So tell us about HPV vaccine.
Good morning to everyone. Good morning, our listeners. As a country, we are moving into introducing the HPV vaccine. It's a strategy that the country will be using to eliminate cervical cancer by the year 2030. So this is a strategy that we are saying, let's bring our fire to eliminate cervical cancer by 2030 by using e-vaccination for HPV. We know as a country we are leading in terms of cervical cancer cases and also in mortality, like people who are dying from cervical cancer. Roughly, we have 341 a year, and of those 341 who are diagnosed with cervical cancer, unfortunately, 240 of them die because of late presentation. So as a country, we are moving to say, let's enforce or improve our preventive strategies when it comes to cervical cancer. You mentioned one of the strategies when we are talking about circumcision. We are saying if a man circumcised, they reduce the chances of their sexual partners contracting or developing cervical cancer. Because we know that for one to have cervical cancer, about 90% of cervical cancer cases are related to a virus which is sexually transmitted, that is the human papilloma virus, that is HPV. So that is where HPV vaccination comes in. And to note, we are saying the young girl, 9 to 14 years, is more vulnerable. So why are we saying that? Our statistics in the country is showing that we are having cases of confirmed cervical cancer for young girls as early as 15 to 19, which is where we now say as a country, let us vaccinate our young girls, and also we'll continue to vaccinate the boys as we go along. As we know, HPV infection is just an STI that one can get through sexual contact at any point in time. And it doesn't mean that you have to sleep with many people. You can contract HPV infection the first time you engage in sexual intercourse. So it's a sexual contact infection and it is preventable. Hence, as a country, we are saying, as a strategy to eliminate the cervical cancer by 2030, let's vaccinate our young girls from the ages of 9 to 14 years.
Thank you very much. Young girls, there's an additional intervention for us that is coming, and it is adding to the health package. Let's make sure you take your fire, you access the service, your health will be in your hands, and you will be looking after your health. Our TTR audience is making it live here and bringing their fire in questions. We have comments from Melu Sisimelane, who's excited about the ongoing dialogue that's here, and someone else from Zandile who is enjoying the discussion and being with us here in this discussion and dialogue. Now, Estina, coming back to you, what would you say, how would you view this development of HPV vaccine that will be available for young girls?
I feel like the vaccine is a very good thing since they are putting the health of young girls, since they are trying to help young girls stay healthy. I really feel like it's a good thing, and for everyone who's interested, they should come and get vaccinated to prevent cervical cancer. Yes.
Any message to them that you want to say to the girls out there?
To every girl out there, you should come and get vaccinated because this is being done for us and to protect us from cervical cancer and from dying at a very young age. So, yeah, everyone should bring their fire and get vaccinated.
Bring your fire and get vaccinated. Babel Dlamini, you want to have an additional comment
Yes,
on this interesting move.
I just want to say that as a father myself, I have 2 daughters. One is 3 and the other one is 8. So just 1 year before she qualifies for the vaccine. I just want to encourage all the fathers to really talk to their daughters, to have a conversation around health and around this particular topic, so that when they fall within the eligible years, can they please motivate, can they please take their daughters for the vaccination? That's my message on behalf of the fathers in Eswatini. Can they please take the lead when it comes to their daughters' health?
Yes, fathers out there, take the lead to the health of your daughters. Young ambassador, do you have any message?
I think it's gonna be the same as her, because it is a great move to get vaccinated, because they normally say it's better to prevent than to cure. So if you prevent it earlier as a young lady, or you get vaccinated, you have high chances of not contracting the cervical cancer, which we know it has taken many people, if not early discovered. So as a young lady or young woman, adolescent lady, please get vaccinated.
Thank you very much for that encouragement to our young girls, coming from your equals and your peers, saying when the vaccine gets here, do make sure that you access the HPV vaccine and you will have a protection against cervical cancer. Now, tell us more, Busisiwe, on what to expect as this program starts.
As a country, the preparation are at an advanced stage, so we are hoping to have the first vaccination for HPV to be around June, mid-June. So we'll be using a school-based strategy, which means when we look at the age group, the 9 to 14, they are mostly in schools. So, which is why we are working together with school health and also SRH and also EPI, which are leaders when it comes to vaccinations. So we are not forgetting the ones that are out of school, which is why we'll also have outreaches, and also in some selected facilities like our clinics, we'll also have or dispatch some of the HPV vaccination to say, if an adolescent girl didn't get the vaccination during these 2 weeks or so that we'll be doing the vaccination, because of reasons 1 and 2, maybe they were not feeling well, then they can also access the vaccination in the schools. And we also hope that as we go along, we'll also vaccinate the boy child, because they are also there. As you know, it's a sexual contact infection, so not everyone is immune to it. So all of us are at risk of getting this infection. And also to say to our young girls and young boys, we are saying we are continuing to abstain, because the earlier we engage in sexual intercourse, may it be penetrative or just touching each other in a sexual way, say it might bring you to risk of contracting the HPV virus. So abstain, and bring your fire to HPV vaccination.
Thank you very much. That emphasis on the prevention. Now, I want us to have a take-home message that you want to say as people bring their fire this weekend. Access to health, the right to health. Everyone has a right to health. We exercise our rights to health. What can you say as a parting words to the people as they come to this weekend?
To the people who are gonna be here bringing their fire, I'd like to emphasize on protection in terms of using condoms and using the PrEP, protect themselves, because after this event, they are gonna face the consequences of not using protection. So everybody's entitled to attain health services, no matter their age, their gender, their nationality. Everybody has the right to access health care. Thank you.
Thank you very much. Everyone has a right, regardless of age, gender, nationality, religion. That's the fundamental of human rights. Mr. Dlamini?
As we are bringing fire to the Bring Your Fire, let's make sure, just a request and a plea to the Bring Your Fire crew, let's ensure that we do have protective products like condoms within the venue. And then two, just to those who are bringing the fire here, as a young girl, you have the right to say no, even if someone has given you lift to get here, even if someone has enticed you in terms of the ticket for the entire festival, you still have the right to say no to anything that you are not comfortable with, and the right to report to the relevant structures. And bringing your fire is not saying let's go all the way into doing things that will put us at risk of contracting HIV, even at risk of accidents. And bringing your fire means don't drive, don't drink and drive. If you find yourself having taken one too many, just make sure that you do have a friend who is sober enough to take you back home, a friend who is sober enough to say, don't go with that old man. You've just met that person here for the first time. So make sure that you do have that kind of a friend, a number that you can call late in the night to say, I'm done, mommy, can you please come here and pick me up? And just make sure that it's someone you can trust, not anyone else that you either have met here or someone you really don't feel comfortable with. So bring your fire to Bushfire and make sure that you are well taken care of.
Thank you. Yes, Estina?
To everyone out there who's bringing their fire on Bushfire, just stay healthy and protected, and remember that there is life after bringing the fire.
Thank you. Yes, Busisiwe?
To everyone out there, bring your fire. Let's all screen for cervical cancer, and let's all support our girls as they go to do HPV vaccination. No woman deserves to die from cervical cancer. Let's bring more fire. Let's kick cervical cancer in the country by year 2013.
Yes, let's bring our fire with the confidence that MTN Bushfire brings us here, and they've invested in our health. You know, the definition of health is not just the absence of disease, but complete wellness. And we know that's what we get. So as we bring our fire, let's come confident and ensure that we access the health services that are here. Hashtag bring our fire in 2023. So before we all go our different ways, let's mention that the live dialogue continues. The next one is at 12:30, and it is starting here this afternoon, and it will be the right to have a voice of freedom of expression. So thank you very much, ladies and gentlemen. Bring your fire, the right to health, access to health. Make sure you access your services. Thank you.